For a self breast test, I would first let the woman know what you're doing, and then I would let her know that the skin should be intact all the way around each breast, and I would examine probably 5 to 7 days after the last onset of menses, and the patient would be sitting disrobed to the waist, and I would tell her to inspect, look for any changes in the skin, the symmetry, the contour, any retraction. The skin should be pink, round. The contour should be round, smooth, and symmetric. Her arms over her head and her hands pressed against her head. Her head, with looking in the mirror, each side should be symmetrical. And then putting your hands on her hips and leaning forward. This would show any retractions or dimpling or anything like that. And then palpation, I would tell her to lay down in the supine position on her back and put the arm up like this, hand by the forehead, and then this is the lateral. I would be assessing the lateral portion of the breast at this point, and so which is the most common for any tumors. So I would tell her to work her way with her fingertips from the outside in a vertical position, strip pattern like this, towards the inside, and noting towards the nipple and noting any nodules or anything like that, any pain, tenderness. And then I would have her put her arm out to the side to do the medial portion, and I would again do the vertical strip pattern, and I would tell her to report any masses or nodules in any of the quadrants, and focusing on the upper outer lateral quadrant. And the nipple should be very elastic and not thick, and there shouldn't be any nodule swelling or any ulceration, and there shouldn't be any discharge. And the axilla, in the sitting position, it should be free of rash, infection, and any pigment changes. And I would also teach that common masses between 15 to 25-year-olds could be a fibroadenoma, single or multiple, and they're tender and mobile. And at the age between like 30 and 50, I would advise people of that age that cysts are common, and there could be single or multiple, and they're mobile, elastic-like, and tender. And the cancerous ones usually are multiple, maybe fixed nodules, non-tender, and retraction may occur, may be present. And signs and symptoms of cancer: look for any dimpling, retraction of the nipple, abnormal contour, the orange peel of the skin, the peau d'orange, or that's the orange peel-like look to the skin, and any dryness or discharge of the nipple.